So as a tradition, we have Ning to introduce our speaker, but also right after the seminar, we have design time for student to meet with our speakers. Back to 513 conference room. If you're interested, have more questions, want to know more, feel free to stop by. Hi, Ning, go ahead.
So for today's journal club, we have with us Dr. Anne Hewitt, and she directs the Connecticut team of Clean Water Action Clean Water Plans and coordinates the Coalition for a Safe and Healthy Connecticut to pass health protective policies aimed at mitigating climate change, protecting our waters, and reducing exposure to toxic chemicals at the state and federal level. So Dr. Anne started her career as a critical care nurse, advancing to nursing director. She holds a BSN from the University of Stanford and an MS in administration from UConn. She pursued a Juris Doctorate in order to combine environmental health policy and the law, and was admitted to the CT Bar in October 2007. So prior to joining the Clean Water Action, Dr. Anne worked as an environmental analyst in the Air Bureau at Connecticut Department of Environmental Protection, and was the environmental health coordinator at the CT Nurses Association. She has written and lectured extensively on environmental health topics, particularly on the health impacts associated with exposure to chemicals. Thank you.
Thank you very much. You could have shortened that. So can you all hear me all right? Okay. Do you mind if I speak without my mask? Is that okay? So I just wanted to thank you all so much for inviting me here today and to talk to you a little bit about my work and hopefully answer any questions that you have about how you can engage in public policy and the critical role that you play in doing so. So I hope that I didn't prepare slides because I wanted it to be more of a conversation where I just kind of share about my work and maybe give you some tips that I've learned along the way from trial and error, and also from that I've gleaned from the literature and mentors and experts like yourselves. So does that sound all right? Okay, so feel free again to stop me at any time or just ask a question or whatever you'd like. I also want to learn from you. So I'm assuming, are you all from different, you're not all public health people, you're all from different science degrees and things like that, or?
I think most of them are from our department.
Environmental health, public health. Okay, perfect, okay. Sometimes I get mixed classes, so I just wanted to make sure I understood kind of a little bit about your background. So, as you all heard, I started off my career as a nurse, and I loved that. I worked as a nurse for 22 years, long time. I was always in critical care, cardiothoracic surgery, and I loved the science of that. I loved hopefully making a difference in people's lives. I felt really good about the fact that we could take care of the sickest of the sick. We could crack your chest open, fix your heart, put in a new heart if we needed to, all of these phenomenal things. But what we didn't do a good job of was really connecting what our actions on the environment do to public health and the health of our ecosystem and all of the intricacies of that and the complexities of that. And even in nursing school, undergrad and graduate, I think I had 30 minutes of discussion about air quality and water quality, and we move on. Because there were much more other things that we had to cover and learn. And I always had, throughout my career, a very nagging feeling and frustration and also a passion for wanting to do work that promoted health on a much broader level. And that's where I think you all are so fortunate to be in the position and the place where you are, because you are going to have a tremendous opportunity in so many different areas to make a really transformative change in public health. And that is so rewarding in so many ways. And so I transitioned, I'm not going to tell you how old I was, but it was midlife. Late in my career, I decided, I kind of had an opportunity, decided that I wanted to figure out how to get into policy work and what did that mean and how, what road did I need to go down. And I spent quite a bit of time talking to professors, my graduate advisor at UConn, lawyers, all different folks to try to get a sense of how do you do policy work. And I think you all are so fortunate that you're really being prepared in the science and the practice of public health. I kind of had to figure it out a little bit. For me, my road ended up, I decided to go to law school because I felt as a nurse I was very science-oriented, and I thought that having a law degree would be a good adjunct to my work and help me understand how does the government work, how do laws get passed, things like that. But that was just a personal choice of mine. What I have really relied on in my career is my health background. My background as a nurse. When I'm talking to legislators or the governor or whoever, I say I'm a nurse. I was trained as a nurse. I don't really say I'm a lawyer. So your role as health professionals bring to that conversation a level of credibility and trust from the public and from policymakers that you don't even have any idea that you have, but you have it. And that's really, really, really important. So I hope that you've all read or learned about studies and social science research and polls time and time and time again that health professionals and scientists are trusted across broad demographics for what you convey and what you are promoting. So you should feel really good about that. So the work that I do at Clean Water Action, we're a national nonprofit organization, and we do policy work, so environmental health policy. So we work both at the federal level and at the state level, and also in municipalities. I'm working in Waterbury right now, promoting energy efficiency, and I can talk a little bit about that if you'd like. But primarily, we work on climate, water policy, and I work a lot on toxic chemical policy. And so kind of the two buckets of work that I thought I might talk to you about today are climate and toxic chemicals, but happy to answer any other questions. So with climate change, we often work on policies that don't necessarily, aren't easily translatable to health professionals. So for example, I'm working in Waterbury on reducing energy emissions from buildings. And if I talk to health professionals, they often feel like they are not competent to talk about those issues because it's not within their lexicon normally. But what I have learned in all of these realms is that because I come at it from a health mindset, I can learn the issue. I can learn why energy efficiency and reducing carbon emissions from buildings is important. But I can translate that from a health perspective into why that's important to protect public health and prevent poor air quality in the home or mold in the home or things like that. And that is the message that resonates with folks generally. Um, so when I first started out as doing policy work and advocacy work, I was so nervous. I was so nervous to go up to a legislator and say, "Hi, my name is Ann, and I want to talk to you about this policy to reduce toxic chemicals in children's products." And when I thought about it, it was really strange to me that I kind of had an epiphany that for 22 years I had gone up to doctors every single day of my life and incredibly brilliant people and said, "I want you to do this because our patient is exhibiting these symptoms or has these lab values or has this whatever. So we need to order this." And I had no problem advocating for a patient in that regard because I was comfortable in that little space. And so I share that story with you because as you go out and think about how can you apply your public health professional skills and all of the information that you've learned at school and through your experience to policymakers, it really is very simple in the sense that the best approach is knowing that you are the expert, you are the public health professional. Generally, policymakers are not nurses and doctors and public health folks. For example, in Connecticut, in our legislature, there are 2 doctors and 1 nurse out of 180 plus policymakers. And in our agencies, our Department of Public Health, there's a physician at the helm, but a lot of the staff people are not physicians or clinical people, but they are expert in their fields with respect to health or environment. So you will have to, I hope, will get very confident in your ability to speak to a policymaker as a public health professional. And so I always, I've gotten more confident over the years, the 10 years that I've done this work, to go up to a legislator and say, "I'm Ann. I work for Clean Water Action, Clean Water Fund. I'm a nurse. I'm talking to you about this issue because I'm concerned about this impact on health." And start from there. So I just wanted to hopefully inspire you to, 1, know you already have more expertise than many policymakers, most policymakers, and 2, to rely on that because you are a trusted resource already. And you will be even more trusted as you build those relationships with your local leaders and your state leaders. So relying on that, and then the other thing I wanted to say is that with respect to your knowledge and your expertise as a public health person, more and more now, I don't know if you've noticed this, that even in the news, we're hearing more about health impacts of climate change, health impacts of this. So I think you have a real strong opportunity to really leverage that messaging. So that's a change that I've noticed in 10 years. 5-10 years ago, people weren't making those links and talking about it on the news as much as they are now. So really leverage that. So the second thing that I wanted to just share is that it's really important, as you are the health experts, you are the public health folks, to reach out and build relationships with policymakers. And by policymakers, I mean your municipal, your local governments, your agency staff, agency meaning Department of Environmental Protection or DPH. Get to know them. Get to know your local leaders, and also your state representatives. So in Connecticut, I'm sure you're from all over, right? You're not all living, but you live in Connecticut right now. So we have 1 representative and 1 senator. And so get to know them. they really do want to know their constituents. They love meeting with students who have expertise in particular areas because they rely on you to teach them so that they can help address issues that their constituents are facing. And I'll just give you an example. When I was, many years ago, I was working, I forget what issue we were working, I guess BPA. We were working on toxic chemicals in children's products. And, excuse me, I was working with a coalition of folks, and I always pull in the Connecticut Nurses Association. So I had a new nurse working with me, and he really had never done this work before, but he got very motivated by it. And he reached out to his particular state rep and state senator on the bill that we were trying to pass, and had conversations, met both of them for coffee, got to know both of these leaders. And before too long, particularly the senator was reaching out to Jose all the time for any health question that came up in his district, and really relied on Jose to be a credible, reporter of information. And if Jose didn't know, he would say, I don't know, I'll look it up, I'll get back to you. But it was a perfect example of just the power of building those relationships up front with people that are going to make decisions on your behalf. So I would encourage you, when you can or wherever you are, to think about who are your local leaders and just try to set up meetings with them. And get to know them, get to know your audience first, but then have them get to know you. And you bring up the issues that you care about, that you see in your community. So I don't know, you all live in different areas, but you may be concerned about poor water quality in your community, or food insecurity, or poor air quality if you live in Hartford or Bridgeport. Any of those issues, if you are concerned about them impacting public health, start talking about that with the policymakers and help them to understand what kinds of changes would you recommend that could be enacted in terms of public policy in your community or your state. Okay? They really do want to hear from you, and they work for us, but sometimes I think at least for me, I felt somehow that they were not as accessible as they really are. So I would encourage you to kind of work through that and try to make those connections. The other thing that I wanted to share is that, and I know you've read the couple of articles that I shared with you. It's important to know your audience, and you've probably all been, aware that there's some partisan divides in our country in terms of environmental health policies and who listens to who. But again, by and large, public health professionals across parties, so liberal Democrats all the way to conservative Republicans, public health practitioners and physicians and nurses have a high level of trust. So that's a really important demographic, and that has been shown in research after research and poll after poll. So I wanted to just flag that again for you. But having said that, it is important to know kind of their interests and their frame of reference so you can understand where they might be coming from and utilize your best approach in asking for a certain policy initiative. Does that make sense? Yeah.
I guess my biggest question is how do you speak to them and try and convey them something when, especially when it comes to matters regarding climate change there's always the topic of financing those changes necessary to, I guess, like create some sort of regulation. How do those like conversations happen? Like what sort of like what's your data source? Like what kind of work goes into it? Because I'm very like I hope to follow up with you because this is exactly what I'm very much so interested in doing. So I just like want to know like what goes into that process.
It depends, as any good lawyer would say, right? It depends. It's a tough question. So it depends on who I'm talking to. I always approach, and I'm sure you all do as well, you approach things from a very, you know your evidence, you know your research, you know the science, you have all that. I don't start off with all of that. I have learned that keep your message simple, straightforward, repeat your message a lot, and then once you get into the level of the data or those kinds of questions, then you can provide resources and science or research, whatever, that supports how to fund or why this is an important policy initiative. So those are difficult conversations. Some people, policymakers, are much more amenable to recognizing the overarching externalities of and the health impacts of climate change, for example, and recognize that if we have more extreme heat days and more people coming to the ER and more people out sick from work or heat exhaustion or they've had an MI, that has a cost associated with it to our economy and to our workforce. The more that policymakers can understand some of those external costs, the better. Some, frankly, just don't want to hear that and feel it's too costly and we can't afford it. So that's where knowing your audience is really important, and bringing in any study or research or economic data or anything like that. If you know who you're going to talk to and what their frame of reference is going to be, say it's cost and concern about cost, arm yourself with some economic data to support you. But it's hard. It's hard. That's where you kind of have to use your assessment skills, right? And I don't mean to sound wishy-washy, but it's not a black and white answer. But I'm happy to work with you.
Thank you.
Yeah.
Similar to along the same lines of sort of funding and talks about where the money would come from, given that so many municipality water systems are funded locally and not statewide or federal-wide, and wealth inequality is a big issue across municipalities. Do you have any recommendations about how to approach policymakers or conversations when they might not have the power to change much when the system is structured like that?
Yeah, that is such a complex issue. So, do you live in Connecticut? No. It's a complex issue in Connecticut, I'll tell you that. I think we have 2,800 water systems in our little state, and is that right? I don't know, but it's a huge amount. Some are like little, serve 10 people, others are big public systems. I think one, work with national organizations that are really doing a lot of this work at the federal level, doing a lot of analysis and reporting and advocating, lobbying for major money going into our infrastructure. I think there's increasingly awareness of how problematic our current infrastructure, water infrastructure is, with lead service lines, with leaks, with chemicals, with everything. So the funding requirement is massive. We just got a lot of money coming into states for infrastructure and water infrastructure. So this is where building a relationship with the agency folks and perhaps your governor that is really key. So, and every state is a little different, obviously. So for example, in Connecticut, I got to know our Department of Public Health officials who cover our drinking water. So they have jurisdiction over our drinking water. And our Department of Energy and Environmental Protection has jurisdiction over any other water issue, water contamination, wastewater, things like that. So working with both those agencies, I can understand, I can learn from them, because they really are, they're amazing experts, they're good at what they do. I can understand better about the problems that they're facing and the challenges that they're facing, and then I can help them advocate for what they need. For example, in Connecticut right now, we need a whole bunch of things, but we need funding to replace, not repair, replace lead service lines. Do you all know what those are? So we have old infrastructure in the Northeast. We have old pipes. Many of them have lead. And when lead gets corroded, it leaches out, gets into our drinking water. So we need to replace those lead service lines. And so learning that from our Department of Public Health, and the other issue is PFAS chemicals now. It's a big, huge issue. I am going to, with my team and other advocates, other environmental groups, other public health advocates, I'm going to advocate to our governor for more funding to go to those agencies to do that work and prioritize that work and make sure that we are doing that through an equity lens so that we are addressing the inequities first. So that's how, it's not that I just go to a policymaker and say, I want you to do this, we need to do this. It's kind of learning from those folks and then working with them to achieve the outcome that you want. And sometimes the agencies may not be quite where you are, but once you build that relationship over time, you begin more and more to work together. At least that's been my experience. So now they'll call me and they'll say, what are you working on with respect to PFAS chemicals? What do you think we should be doing? Let's meet and talk about our policy agenda for next session. And that's happened over time. That, takes a while, but that would be my approach. So, yeah.
I just want to add, I worked at the Connecticut Department of Public Health in the drinking water branch this summer, and I think one of the big things that was talked about was creating really sufficient and good rapport between the public health department and the public water systems.
Yes.
Because you have these really large private public water systems like Aquarium Water Company that have such a big monopoly on public water systems in the state, and a lot of times they don't really accurately report data when there has been incidents or chemical spills or main breaks or lead issues. They're not geographically sent to the public health department in a really refined and accurate manner because in a way they fear kind of public the public department's reaction to it.
Yep.
So that was a big issue, is how can you create a rapport, how can you create a system where these public-private partnerships are very communicative and also trustworthy of each other. And yeah, that was an issue that just came up a lot in Connecticut.
Thank you so much for bringing that up. It's a huge issue. And again, I'm kind of sharing the Connecticut experience because this is where I live, but I'm sure this is happening in other states as well. There's always these tensions between agencies, between the water systems, public, private, all of that. It's a very big deal, and it's complicated even more now by who has jurisdiction over what, who has money to monitor what. And our large public water systems are, and this is happening around the world, are being bought up by huge companies. So that's a real concern. We don't even own our water. But I think one of the things that's a very tough issue. You guys are asking hard questions. We have to have a right to know. And that's where you as advocates can play a big role. So for example, in Connecticut, we just passed a couple of years ago a sewage right to know bill. Do you know about that one? That took a lot of time. That is a law that increases transparency when combined sewer lines overflow and sewage backs up or gets into our streets or basements or whatever, water, overflows into the rivers. We wanted to have more transparency for that. And you can imagine that there was some hesitancy about that. We don't want to alarm people, we're taking care of it. There were delays. And we did pass a sewage right to know law because we finally convinced everyone that it was really important from a public health issue that if I'm living in Cromwell and or Hartford where this happens quite a lot, I as a resident have a right to know that I might be exposed if I'm walking along that stream or whatever. So because we approached it from a public health perspective and an urgent health issue, we got the law passed. It's not easy. Nothing in this work is easy. We have so much opposition to common sense things. That's the thing I struggle with a lot. For me, when I came in to this work 10 years ago, our first thing was banning toxic chemicals in children's products. I'm thinking, who wouldn't want to do that? Why can't we just get that passed? It's the opposition to things is monumental and doesn't make a lot of sense, but is often financially driven by industry who profit off these issues. And so I encourage you to be resilient. And again, know your data, know your science, know your research, build on your credibility that you already bring to the table. But that is a tough issue. Yeah, even our towns, we have 169 towns and everybody wants to do their own thing. Yeah.
In your 10 years, do you feel like there's certain topics that you've had a lot of momentum in and then others that just have stagnated throughout? And could you touch on the ones that haven't really moved or the areas we feel like we should probably...
Yeah, I hate to say this, but the chemicals of concern in children's products never moved. We did get a bill passed to ban BPA in baby bottles and recyclable containers and infant formula containers in 2009, and we were the first state to do that. But BPA is one chemical. And so when we did that, we felt really good for about 2 months, and then we realized that the chemical industry just changes it to BPS or PPF or whatever. And so we try to avoid regrettable substitutions. That led us to try to pass a bill and this was the bill name, I think, Chemicals of High Concern to Children. Seems simple. Ban these chemicals from products that are harmful to a fetus or a baby, children. And the opposition from the chemical industry and from many lawmakers was, oh, we can't possibly do that. It's the cost issue. It's going to shut down our economy. It's going to cost too much. How do we figure that out? What's a chemical of concern? It was just crazy. Even though other states had moved in that direction. So we just never won that. we worked we're working still on climate, worked on that for many years we didn't get anything passed. PFAS chemicals, you all know about PFAS chemicals? So that one, we started talking about PFAS chemicals to policymakers in 2010, I think it was. And, just nothing. People didn't know about it, legislators weren't educated about it. By this time, the legislators knew me, so they felt like, well, I was probably talking about a real issue, but we didn't need to worry about that yet. So it didn't pass. So that, a month later, we had a spill of firefighting foam into the Farmington River. I don't know if you all heard about that, but that was 40,000 gallons of foam that went directly into the Farmington River. So that crisis turned into an opportunity because the next year, guess who came back and got a bill passed? And by that time, we had unanimous bipartisan support. So, and we had the firefighters on board, and so we not only passed a bill to ban firefighting foam and make sure we switched to a greener foam, we established a take-back program in the state, so our environmental agency took back all of the toxic foam, so our municipal firefighters and municipal governments didn't incur that cost or liability, and we switched to a new foam. In addition to that, we passed a ban to restrict PFAS in all food packaging. So I hate to say it, but a crisis and the news leveraged us turning that into an opportunity. And that's sad, but that's where I think you all, again, can play a really important role, because you can use not only your expertise as scientists and health professionals, but learn how to use the media. Work with the media and develop relationships with them. And, I would bring in stories about PFAS contamination, for example, from other states, or what other states are doing. So share all of that to build momentum. Does that help? Yeah. Okay. I hate to say that, but sometimes you got to leverage your crises. And personal stories. So I want to take 1 second to just, I've read a lot about our messaging, and I kind of learned this on the job. And then I started reading the literature, social science literature and all of that. Because I came from a science and a nursing background, I tended to talk too much science. Speak all the data, all the facts, all the research, all the, this and that. I had my citations, my this, my that. And when you're talking to policymakers, I frequently found that their eyes kind of glazed over. They didn't listen to me as well. I think they believed me because they knew me, they trusted that I was trying to tell the truth, but didn't have time to absorb that level of detail. And so I learned to keep my messaging simple, at least to start. And when I read some of the literature and learned over time, really as, you'll have all of this knowledge in your heads and from your background and your experience and your work that you'll be doing. But when you're talking to a policymaker, you might want to start off by keeping your message very simple. What's the concern? What do you want them to do? And here's the solution. There's a solution. We can fix this. You can fix this by doing this. So keep your message simple and repeat it and repeat it and repeat it and repeat it. And that did not, I'm still not really good at that, even after 10 years, because I get too much, I have all my papers with me, I have the research, I have this and that. They barely will read a fact sheet because they're so busy. And this is no disrespect to them. Their legislators are incredibly busy. So, you'll be catching them and maybe have 2 minutes to capture their attention. So you want to use the skills you have, get right to the point, keep your message simple, and repeat it, repeat it, repeat it. And as they know you, you're trusted, you're credible. And the other thing that I learned, and I see in the research, is that public health professionals are perceived to be benevolent, that you come at this from your heart, that you want to make a difference, you want to help people. And those three together, trustworthiness, credibility, and benevolence, are 3 skills that you already have that are incredibly helpful and well-researched to show their positive impact on policymakers. So you've already got it. So that was one thing. And then there was one, let's see if I can find it really quick. I don't know if you recall, in this article that I think you all read, Health Communications about PFAS, it talked about a lot of the state agencies or government agencies or groups and how they framed PFAS communication. And you'll note, or go back to it when you have a second, that a lot of the sentences were kind of vague. Studies suggest some scientists may think that PFAS is linked to liver damage. A lot of vague, ambiguous statements. And what scientists are finding, and social scientists are finding in analyzing all this research, is that it's better for a policymaker, and actually what the public wants scientists and health professionals to do, and believes you have a duty to do, is share the evidence. Share the evidence, share that there's a risk of harm, share that there is evidence of harm to health or the environment, and just be clear about it. And that resonates much more than saying there's 500 studies that show or suggest that there may be some level of harm or some level of liver damage from PFAS. So you see the difference? So I would encourage you as health professionals to really think about your messaging, and you'll learn it faster than I did. The other thing that I wanted to show you, actually, let me jump to one more if I can find it quick. Here. So I thought this was a good example, and I wish I had read this 10 years ago. So this is just an art, and I will share this with you. I had not shared it, but I will. It's from George Mason University, and they have a center on climate change communication, and I think Yale actually works with them. So this was harnessing the power of communication and behavior science to enhance society's response to climate change. And they have a little chart in here, which again, I'll share this with you, about how to frame things, how to frame your message. So global warming, is happening. How would you say that better? Or could you say it better? It's real. They say it's real, simple. Like, just keep it simple. Human activity is the cause of climate change.
It's ours.
It's us. Yeah, it's us. Don't even debate that anymore, right? It's happening. 97% of the world's scientists agree after years of study that global warming is happening and it is caused by human activity. Scientists agree. Experts agree. Did you read this?
I know this.
Climate change causes, or may impact serious human health effects. Don't say anything. It's bad. What are we seeing here in Connecticut? Way more extreme heat days, right? What did we experience? Well, we're still in a drought, right? We have not typically had droughts like this before. So bring it right down to your community. We are seeing, wherever you live, what are you seeing? More wildfires, more smoke, more, whatever it is, more blue-green algae in my ponds and in my lakes, right? And lastly, there are things we can do if we follow the science and move beyond our differences. There's hope. We have a solution. Here's what you can do. So I was way on this side of the for so long, and many times I still am. So I have to work to think about my messaging before I go in to talk to policymakers, even those that I know quite well. So I will share this with you, and I just found it really helpful. And it's in line with not only my real world experience, but the social science data that is showing this time and time and time again. So I wanted to share that with you. Yeah, and I really do want to emphasize that the benevolence piece I thought was really important. I had not read that before. I had read that scientists are trusted, we're credible, we're believed, but the benevolence part I thought is really critical. And just from my own experience, I have found that to be true, and I never really thought about it from a scientific perspective before. But I have found that people do listen to me, lawmakers, policymakers, and I think it is because I've taken time to build relationships, but I think they also recognize that I truly am coming at this from, I care about human health and the health of our ecosystem. I'm not coming at it from a legal mind in the sense of, we can pass this law because blah, blah, blah. So there's a difference, and I think you bring that. And then lastly, I think just really developing, as I said, a sustainable, repetitive, action-oriented message. So on the policy initiatives that I work on, for example, climate change, I have found it challenging to get health professionals to work on these policies that are being proposed at the state level, for example, in Connecticut, because they often, the policy itself won't say enact to improve public health. It will be something like enact to reduce carbon emissions from buildings, or an executive order that the governor wrote passed to require electric suppliers to be 100% renewable by 2040. Those are often issues that I have found it's very hard to engage nurses or physicians or health professionals to advocate for, because, and I felt this way too, I'm like, I don't know anything about building emissions, I don't know about transportation. But when you can, as I said this earlier, when you can translate what that policy is trying to achieve to other people like yourselves, and get a group of you to advocate for particular policy, like let's shift to electric vehicles by 2040. Let's make sure our government, any vehicle that they purchase is electric starting now. If you can talk about that from a health perspective, about why we want to do that, and get other people like yourselves involved, it is so powerful. If you all got 5 people to call your legislator on a particular bill, research shows that even 5 calls to a legislator can make them flip their vote. So that's power, and you have that power. So I encourage you to, to use it. We need help at the Capitol. So let me see. I don't know how I'm doing on time. Do I have
52. We have 8 minutes.
8 minutes? Okay. So just in terms of, for example, a messaging point from our PFAS work. Now we passed those bills, the firefighting foam bill and the food packaging bill. We're now working on a food packaging bill at the federal level to restrict PFAS. I don't know if you've heard of that, but that's an opportunity if you want to call your state legislators and tell them to get that passed. But one of the things we're doing now is meeting with agency officials here in Connecticut and our governor to do more. And so one of the ways that we crafted our messages, I say we want to turn off the tap of PFAS chemicals. And that seems to be it's kind of a weird slogan, but it seems to be effective in the sense that legislators remember that and they understand it. Because what that means when they say, well, what do you mean? It's preventing any additional products that contain PFAS that is unnecessary to that product's function or utility or whatever, or process. We should not be having those in commerce because what happens? They expose people, and once those products are thrown out, they get into our environment, they are not incinerated, they get into the air emissions, they contaminate our water, etc. So we want to turn off the tap of PFAS chemicals. And that message is resonating. So, again, keep it simple and repeat it, repeat it, repeat it. We did that with, although it took a long time, with the precautionary principle. So you all know what the precautionary principle is? It basically is just, if there is evidence of harm, you should take actions to mitigate that harm. And that's something that is intuitive to us, to me as a nurse. If we see somebody that's that's confused and is gonna fall out of bed, we were trained to have a sitter there, reorient them, put the side rails up, prevent the harm. We didn't wait till they fell and cracked their skull, right? So, but for some reason, we don't apply that same principle in environmental law or environmental health policy, but we should. And so we started saying precautionary principle to our Connecticut legislators, 10 years ago, and now you'll hear them talking about it. They may not always act on it, but at least they get it. So it's things like that it's the building blocks of change that I think if you can be patient and resilient, you will persevere and you will make those positive changes in your communities. And that's something that you're going to have an enormous impact on and such a fulfilling career. I know people have asked me in my career, why did you leave nursing? And I always say I didn't leave it, I just do it at a much broader level. And people ask me if I'm happy that I made the change. And I say yes. Do I have some bad days where I want to, I get frustrated at a legislator or somebody? Yes, a lot. But most of the time, I feel that the work that we will all do together is so rewarding. So I really am excited to get to know all of you more. And if any of you want to work with me or ask me more questions or reach out, whenever, please do. And I think I will stop there.
Yeah, we have one quick question. Let's do the class afterwards.
Hi, thanks for coming today to speak with us.
My pleasure.
I was at a conference last week about cities as solutions to climate change, and there were all of these urban planning and policy solutions mentioned, and Mayor Elliker was there, and he responded saying that Like, we would be more inclined to do these things if the public were aware and were actively asking for these things, and he sort of saw that as a barrier to action. Do you do you often think about community engagement and community and like education
Yes.
as like a pathway?
Yeah,
Or how
that's
does that
all I
work?
do.
Okay.
Yeah, I would say 90% of my work is community education
Okay.
and building a coalition of advocates that can help, address the issue and call that policymaker. Absolutely, that's all we do. So yeah, it's not me doing it alone. It's I pull in other people, I pull in other experts, I pull in. So if I was in, that situation, I'd be thinking about who can I get to talk to the mayor and make it a diverse group.
Right.
So, yeah, so important. Yeah. And he's good on these issues. So, but yeah, that was a good message. He's giving you, he needs political support.
Thank you. I think we thank our speaker again. Thank you.
Thank you all.
If you do not have time.